When you've dislocated your shoulder, what that means, there's two ways it can dislocate. The ball of the shoulder can dislocate out of the front, or the ball of the shoulder can dislocate out the back. More common, the shoulder would dislocate anteriorly than posteriorly. So when the shoulder dislocates, naturally something will tear. Frequently when the shoulder dislocates out of the front, we'll have something called a Bankart tear, which is a tear of the labrum from the socket. So if we pull the ball away and we look inside the shoulder, there's a socket. The socket is pear-shaped, and attached to the rim of the socket is the labrum. So when the shoulder dislocates, it will tear the labrum from the socket, and sometimes it can even tear the capsule or the ligaments that help stabilize the shoulder, or it can stretch those. The other thing that can happen is when the ball dislocates, this part of the ball on the backside will hit the front part of the socket and actually get a dent in it. That's called a Hill-Sachs lesion. So we have two primary problems. You have a torn labrum, and often you have a dent in the shoulder called a Hill-Sachs deformity. So depending upon your age, individuals under the age of about 21 to 22 years old, if you've had one dislocation, there's nearly a 60% chance that you'll have subsequent dislocations. Each of those dislocations can cause more damage and more trauma to the shoulder, making the repair less predictable. So in younger individuals, first-time dislocations, we're generally recommending that we repair those to avoid subsequent dislocations and to avoid more damage to the labrum and to the socket and to the ball. So for individuals over that age, there's less incidence of recurrent instability after an isolated dislocation. So for those individuals, we'll frequently obtain an MRI to make sure there's not other structural damages. And assuming that the MRI demonstrates just a labral tear and no rotator cuff tear, then we'll treat that non-operatively with physical therapy and rehab. If you have subsequent events and the shoulder becomes more consistently unstable, then you may opt to have it repaired. So how do we fix these? So we position you in the operating room. Usually you're actually laying on your side, you're asleep. Your arm is extending up like this. We make some small incisions around the shoulder that are big enough to put a pen in, and through that pen you would put a camera into the shoulder and tools to do the repair. There's usually two things I'm fixing. One would be I'm repairing the labrum down to bone, and we use things called anchors. So the anchors are just like a boat anchor in a sense, that there's something that's anchored into bone, and then there's a thin suture that passes through the labrum, and we stabilize the labrum up against the bone. Usually we put 3 of those in the front. Sometimes we have to do anchors in the back, and then we'll often fill in that defect in the ball part, the Hill-Sachs deformity, as well. And that's also done arthroscopically. After surgery, you'll have typically 3 or 4 incisions around the shoulder and a dressing, and you'll be in a sling.